2 weeks after surgery, you will have an in-person follow-up visit. Typically, this visit is with an advanced practice provider, such as a physician assistant or nurse practitioner. At this visit, we will assess your surgical site, discuss your progress, and we will review post-operative medications with you. 6 weeks after surgery, you will have an in-person follow-up as well. This is typically done with a surgeon, and at this visit, you can discuss return to work timing and restrictions, as well as any lingering questions you may have about your recovery. We don't recommend returning to work prior to 6 weeks from surgery, as this time should be devoted to your rehabilitation. We ask that you return for a follow-up visit with your surgery team every 1 to 3 years after your surgery. At this visit, you can plan to check in with your surgeon for new x-rays and discuss how you are functioning overall with your new joint. The timing may depend on your surgeon's preferences and your overall function and satisfaction. Restrictions are minimal after a knee and hip replacement, but we do not want you driving until you can safely operate a vehicle and are off all narcotic pain medications. Long-term restrictions include a strong caution against high-impact activities like running and jumping, as these activities increase the risk of wearing out your plastic liner and/or loosening your artificial parts early. In most cases, you may walk long distances, hike, swim, cycle, play golf, or other similar activities without restrictions. For hip replacements, there may be range of motion or movement precautions following surgery, so please follow the instructions of your surgeon, physical, and occupational therapists. Sleeping is an important part of rest and recovery. When asleep, you should avoid sleeping on your operative side for 4 weeks. If you are a side sleeper, you should have a pillow between your knees to align your hips and your spine. Your incision should not get wet until fully healed, typically 2 to 3 weeks. Keep the postoperative dressing in place until your clinic follow-up, unless you have been instructed otherwise by your surgical team. In the first few weeks, we want you practicing walking a lot. At first, you will need a walker, and then a cane, and then eventually nothing at all. It will take practice to work on not walking with a limp, but should be worked on early in the rehabilitation process. You should be working on your early basic exercises taught to you by your therapist in the hospital every day in the early weeks. The primary indicator for a good outcome following total knee and hip replacement is quality, consistent physical therapy exercises on your own at home in the early days and weeks following surgery. Work on getting your knee as straight as possible, even in the knee brace if you have one. Your therapist will call this a quad set, which is where you force the back of your knee down to flatten the knee against the bed or the ground. Everyone regains their knee bend at different times. A general goal is to have 90 degrees of bend in the knee by 2 to 3 weeks. If you remain stiff after 6 to 8 weeks of consistent therapy, sometimes we can help with this, however requires an additional short procedure while you are asleep with anesthesia called a manipulation. This is where we bend and straighten the knee to break up any scar tissue that may be limiting your motion. This can be discussed with your surgeon at the 6-week postoperative visit if you have concerns. For a good outcome with your hip replacement, continue to follow the restrictions you were given until your surgeon clears you to resume normal activity. Call the orthopedic clinic if you have issues or concerns with your dressings or incision, blisters, calf pain or swelling, or new or uncontrolled pain or fever. Many of these things can be normal part of the postoperative course that may be able to be addressed over the phone or with an orthopedic clinic visit. If you are having a medical emergency like chest pain, shortness of breath, or you feel like you're going to pass out, please call 911 or present to the emergency department immediately. Early swelling, bruising, pain, and skin discoloration is expected. The goal of a hip and knee replacement is to reduce your pain and improve mobility to allow you to do low-impact functional activities with more ease, such as working, walking, hiking, golf, cycling, etc. However, returning to these low-impact activities will take time, and the timing will be different for everyone. Often, a return to low-impact activities will take 3 months or more after surgery. Kneeling after knee replacement will be a challenge for people who need to kneel for upwards of 1 year. There are no formal restrictions against kneeling. However, you should wear well-fitted knee pads for any prolonged kneeling activity, such as gardening or cleaning. It is important to note that despite not having any formal restrictions against kneeling, many people avoid kneeling after knee replacement due to discomfort. Navigating stairs up or down with ease may be one of the last things to return following a knee replacement. Focusing on good quadricep control, the muscle in front of your thigh, is important. When it comes to routine dental cleaning, we typically do not prescribe antibiotics anymore beyond the first 6 months following surgery. If there is a dental emergency in the early weeks or months following surgery, we may want you to take an antibiotic before dental procedures. If you have questions or concerns about this, please discuss it with your dentist, or you can call your surgical team. Thank you again for choosing Hennepin Healthcare for your orthopedic surgery. We thank you for entrusting us with your orthopedic care. We are confident that you are on the road to a full recovery. We are both excited and honored to be on this journey with you.